So what is fibromyalgia? Well, fibromyalgia is actually a type of nerve pain or neuropathic pain. In the old days, it was a pretty terrible diagnosis to be given because doctors didn't really understand it. They were presented with patients who are often in a lot of pain, all over body pain. They're often very upset, very depressed, quite tearful. To be fair, they didn't really know what to do to treat them. Fast forward to now, we know an awful lot about fibromyalgia syndrome or fibromyalgia as an entity. As I said, it is a type of nerve pain or neuropathic pain. And what we know is that there's dysfunction of the nervous system, which leads to a lot of very characteristic symptoms and signs that patients have. Now, with fibromyalgia, the hallmark of the symptoms is pain, and patients will describe essentially all over body pain, pain pretty much all over their bodies, sometimes missing a few areas, but it is widespread. That's the key. In association with the pain that they experience, they often have very marked, very significant fatigue, tiredness, and low levels of energy. They also have a lot of sleep disturbance. Sleep is a big problem for patients with fibromyalgia. And along with all of that, they often get a lot of what we call cognitive disturbances. So what does that mean? Well, essentially, they may get disturbances of their short-term memory, disturbances of thinking, and that sort of thing. And if you take a step back and look at all these symptoms, you can see most of them are neurological type symptoms that patients experience. And as it is a type of nerve pain or neuropathic pain, that makes absolute sense. When you're faced with a patient with fibromyalgia syndrome, the most important thing is always to find out what is the potential underlying cause. And we often can find a cause. If we look back, we may find some sort of physical trauma. For example, road traffic accident is quite common. Psychological trauma, if people have been through psychologically challenging times. Often we have patients who have fibromyalgia who, when you look back, have had some sort of infective illness. And certainly certain types of viral illnesses are associated with fibromyalgia, as well as another very similar complaint, which is called CFS or chronic fatigue syndrome. At the London Pain Clinic, when we've seen patients who have fibromyalgia, we will do an initial assessment. We send out questionnaires to the patient, and we get all the information that we need regarding the pain, site, character, duration, radiation, aggravating, relieving, associated factors. We'll also look at the treatments they've had, the investigations that they've had. What we tend to do in terms of diagnosis is to take all of that information together, but then if we suspect that they may have fibromyalgia syndrome, we will use something called the ACR, that's the American College of Rheumatology, diagnostic criteria from 2010, diagnostic criteria for a diagnosis of fibromyalgia syndrome. And that can be an extremely useful exercise. Very often patients haven't done that. Very often patients are seen and told, well, you might have fibromyalgia. But by using this diagnostic criteria, it is actually very effective in seeing when patients actually do have it. And then based on that criteria, we can give a formal diagnosis of fibromyalgia syndrome. And then once that's done, we can start to talk about the various treatment options that are available to the patient.